current role, I work 12 hours a day, 6 days a week. It is very hard work.
Glenn O'Driscoll is a registered nurse. 730 first met him in January when he was part of a rapid response team travelling between aged care homes with COVID-19 outbreaks. He's still living out of his suitcase, helping plug staff shortages.
COVID has not gone away. It's still very much present in aged care at the moment. A lot of facilities that have had outbreaks in the past are now getting second outbreaks.
It's been over a year since the Royal Commission into Aged Care revealed stories of substandard care and found Australia's aged care system was understaffed with an underpaid and undertrained workforce. Glenn, who's a member and former branch secretary of the Nursing Union, says for staff, nothing's changed.
They work double shifts, they work overtime, they work extended shifts. They are tired, they are worn out. COVID has not created these workforce issues, it's exacerbated them.
Labor is making aged care a key election platform.
There you go.
Amid ongoing stories of understaffing and COVID-19 deaths in aged care. The Royal Commission made it clear the aged care sector needed to attract more nurses and care workers and recommended an increase to award wages.
Their pay rates are below their compatriots in disability services, the health sector and in areas like retail.
The government didn't accept the recommendation for a wage rise and didn't make a submission to the Fair Work Commission. The Commission starts hearings today into whether aged care workers under 3 awards should receive a pay increase of up to 25%. The Coalition has said it will ensure the Fair Work decision is honoured, but hasn't committed to fully funding it through government subsidies.
So what we say is there's an independent pricing authority that determines, based on all the input costs, what that increase in subsidy will be.
For a sector where 60% of residential aged care homes are in deficit at the moment, and basically 2/3 of all homes in regional Australia are in deficit, we can't afford a pay rise without the government fully funding it.
Labor has committed to fund whatever pay rise the independent umpire decides.
These people need and deserve a pay rise, and aged care is not going to get fixed without it. So from my perspective, Labor is just being realistic about that.
Anthony Albanese made aged care the centrepiece of his budget reply speech, promising $2.5 billion over 4 years for measures including better food, stricter reporting rules for providers and greater penalties for covering up abuse. Key to Labor's promises are 2 Royal Commission recommendations: having a round-the-clock registered nurse in every aged care home and making sure residents receive 215 minutes of care per day. In its response to the Royal Commission recommendations, the Coalition government committed to a registered nurse being on site 16 hours a day and promised 200 care minutes. But on the campaign trail, the government has hinted it's willing to go further.
We have accepted the recommendation of the Royal Commission for nursing staff to be on premise 24 hours a day, 7 days a week, but we also accepted the Royal Commission's recommendation that it would take us until 2024 to be able to do this.
A key question for Labor has been where it will find the staff to meet its nursing and care minute commitments.
We can't just make nurses all of a sudden fall out of the sky and be able to go and meet a 24/7 commitment to have a nurse in every single aged care.
We'll need about, at full-time equivalent, somewhere in the order of 750 additional nurses in the sector. Most nurses in aged care work part-time, so it's somewhere between 2,000 and 3,000 new people coming into the sector. This is eminently doable.
Hal Swearison, a former Keating government advisor who's now a professor of health policy with La Trobe University, says finding that many workers will be a challenge, but not impossible.
So if the Fair Work Commission makes a ruling soon that aged care staffing pay should go up and that staffing is paid for, that will make it more attractive to bring people into the aged care sector, and provided that funding is available, that should be manageable. But there are a fair few ifs in that equation.
Labor is also promising fee-free training places to boost the workforce. But Anthony Albanese today confirmed the party will also need to recruit overseas workers as a stopgap measure to meet its nursing promise. Nairi Morley has been in aged care for 6 years. She has dementia. Her daughter, Kylie Bennett, doesn't see her mum as much as she'd like because she also cares for her granddaughter who has autism.
If you plan on joining a safari, don't get dressed for going on a cruise.
Kylie took Nairi out for Mother's Day last year and says she noticed a small sore on her leg.
I let them know at the nursing home. They did ring me a couple of weeks later and said that they're looking after the wound and it's got a little bit bigger and they're going to dress it and give Mum some antibiotics.
Kylie said the wound had gotten worse when she saw her mum a few months later.
It was smelly and gapey and I was nearly vomited in the car park undoing the wound. I was so surprised that it had got this out of hand. They said that the wound had just got bigger and they were treating it with antibiotics.
Kylie complained to the aged care regulator about how Anglicare St Martin's nursing home managed her mother's wound and pain. She also complained that the home hadn't managed Nairi's changing behaviour properly, resulting in inadequate hygiene and infrequent showers.
When I started to give her a shower, I noticed all black on the back of her neck. They said that she was being very awkward and not wanting to have a shower, but I just can't understand why they wouldn't shower her.
The Aged Care Quality and Safety Commission found the home did monitor and manage Ms Morley's wound and pain, but not at an expected level. It found there were delays in escalating the wound's changing condition to a GP and external wound care service, and the home didn't properly assess Ms Morley's pain levels. The regulator also found care and management of Kylie's mother's behavioural changes hadn't met expected standards, but the regulator said it was satisfied with actions that had been taken to improve care for Ms Morley and other residents. In a statement, Anglicare Southern Queensland said the issues raised by Kylie had been investigated and addressed, and since the complaint it had worked with Kylie, her mum and the regulator to ensure a high quality standard of care.
I know it's too late for my mum, but I just want everyone else to know that when you put your mum in a nursing home or your father or your loved ones, that you've got to keep an eye on what's going on.
Following the Royal Commission, the Coalition pledged $18.8 billion over 5 years to improve the sector. 7:30 requested an interview with Anne Ruston, who will take over from retiring MP Greg Hunt as Aged Care Minister if the Coalition is re-elected. The Coalition's campaign team said Senator Ruston isn't the Aged Care Minister, and neither Mr Hunt nor the Aged Care Services Minister Richard Colbeck were available. One of the Coalition's big spending promises was $6.5 billion to roll out 80,000 home care packages over 2 years. 32,000 of those had been released at the end of April, but more than 60,000 people are still on the wait list, with wait times up to 9 months.
So that's an improvement, so there's no doubt about that, but they're still massively unacceptable.
Labor has pledged to match the Coalition's promise on 80,000 extra home care packages.
The difference between Labor and the government is that right now there are no staff to deliver those home care packages.
The Royal Commission recommended the government look into an aged care levy to address chronic underfunding, something that's not palatable to either party this election.
So the community needs to bite the bullet on this. Either you fund this thing properly and you do require proper management, or you continue with a system which is always going to have quality problems, access problems, management problems as we've currently got.
The Royal Commission's been done and dusted for a long time, but on the floor, nothing has changed. Care workers are disillusioned. They have lost their faith in the government process, regardless of the party.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.